More than 2 years into the pandemic, billions of dollars have been spent by the federal government to support struggling business owners. Our investigative team has been tracking those funds, including a look at doctors who received them. Senior data journalist Valerie Willette is here to show us what they found.
We wanted to put numbers on just how difficult this pandemic has been for doctors from a financial perspective. So we dug into the billings of 58,000 doctors paid by provincial health insurance. And what we found is really a story of two pandemics. One where the majority of doctors saw significant drops in their billings, and another where a smaller group of higher billing doctors, most of them specialists, had a much better year, some even benefiting from COVID emergency funding. According to our CBC News analysis, in the first year of the pandemic, 1 in 4 Canadian doctors saw their billings drop by 20% or more, significantly higher than in the previous year.
The healthcare system's not very well organized.
This family doctor isn't surprised. He says many clinics scrambled to stay open through repeated lockdowns.
People need to remember right back at the beginning of the pandemic, things were really shut down hard. And so for example, I'm in family medicine. Our visits dropped just like a rock down to, maybe 10-20% of the people we would normally see.
But not all doctors. We looked at 600 of Canada's highest paid, most of them specialists, billing between $1 and $6 million a year. Just 7% saw that same dramatic reduction, and many billed more than before. We also found 1 in 4 of them received money from Canada's Emergency Fund for business owners.
I would imagine with the kind of billings that those top earners have, that they're running a large clinic with a large staff and probably a lot of overhead costs and other things as well. So if CEWS allowed them to maintain that so they could bounce back faster, they would be in a better position to kind of pick up that work.
They're still potentially on the hook.
This business ethics professor says the doctors should give that money back.
The purpose of CEWS is to make you whole. It is not to transfer taxpayer money to a windfall.
Now, Valerie, you've reached out to some of these top doctors. What do they have to say?
Well, one important thing to point out here is that nobody is suggesting that this funding is illegal or broke the rules. But still, we reached out to a number of these doctors to find out their point of view, have more context, and 2 of them got back to us. One is a Manitoba ophthalmologist who billed $3 million in 2020, and he told us that he used part of the funding to support his 10 employees, and that when the restrictions were lifted in his province, he was swamped by patients and eventually decided to pay back this funding in full. The question now becomes whether other doctors will follow suit.
Valerie Willette, thank you.